So the last section here, we're going to talk about controlling pain. The first one and the most common one, it's going to be pharmacological controlling of pain, which going to be administration of drugs, which going to be the most common ones. There are going to be at least 3 different categories of drugs that can help physicians or your doctors to just control your pain. Number one going to be local anesthetics, in which they're gonna actually, if like local anesthetics, it's gonna affect the transmission of pain in your body. So like from your peripheral receptors to your spinal cord. Number 2, like the second category is gonna be spinal blocking agents, like epidurals. For example, whenever you do have pain in some part of your bodies, it's not gonna, because it is blocked from your spinal cord, it's not gonna go from your spinal cord to your brain to perceive the pain. The last category gonna be antidepressants, which gonna affect the pathways. So this way, your brain cannot actually perceive the pain to its like correct state. So your brain actually gonna underestimate the pain and not gonna actually perceive it in a correct way. For example, when you are having alcohol, you cannot perceive pain in a good way. So that's why after having a breakup, most people, they're gonna go have alcohol or do substance use because they are like antidepressants and it's gonna block all the negative emotions and all that. For some people it's different, but in general, especially for physical pain, antidepressants, they can be effective, but don't do that. I'm not advocating for that. Don't do that, but they are effective. I'm just saying. But yeah. There are going to be so many drawbacks when it comes to pharmacological controlling of pain. Number one, going to be side effects. They do have a lot of side effects. Otherwise, all of us, we do alcohol and drugs all the time, right? Number 2, going to be addiction. Speaking of drugs, yes, it's going to be addiction. After some point, you have to just increase your dosage, and it's going to get worse and worse and worse. So another category of controlling pain, it's gonna be surgical. You have to undergo surgery. They're gonna cut down some part of your spinal cord or your CNS or your PNS. But the problem is like the drawback here, it's gonna be, surgical way, it's gonna be very expensive most of the time. And you're gonna lose some part of your body, or it's gonna bring you lifelong damages, which is not good. Sensory controlling, it's very interesting. I didn't know about this until I read the book, your book. But it's gonna, sensory controlling, it's gonna be counter irritation, which gonna be, for example, whenever you are having pain, chronic pain in some part of your body, they, like the doctor, they're gonna give you another sort of pain, but it is a mild one in like another part of your body. So this way, your brain gonna get distracted from the pain that you already had, and over time, your brain can understand there are gonna be other pains in other part of your body. So the chronic pain can be acute pain after a point, and you might get better or recover from that. I feel like that counter irritation is just very interesting. I never heard about this, but if you have any experience of sensory control inhibition, just let me know. I can just share it with the class. I am not sure about this. Like, you already have a pain, but like doctor gonna give you another pain. It's just kind of crazy. But from the articles that I was reading, it seems like it is efficient. Like people with chronic pain, they are using this. Especially like arthritis. People with arthritis, they are using what was that? I forgot the name. They are using counter irritation all the time. So there are going to be some psychological ways for controlling pain. It actually demands the patient to actively contribute to the program and learn from that, then apply that in their daily life. So if the patient wouldn't actually agree for doing that sort of psychological controlling of pain, this way cannot be effective at all. Biofeedback, it is very good. I really like that. It is just good for your automatic behavior. For example, your blood pressure, your heart rate, like something that you are not aware of that consciously, and it is like very unconscious behavior, not unconscious, automatic, I would say, behavior. But the story here is, just imagine if you are having panic attacks or something like that. Biofeedback lets you to just understand your typical natural rate of your heart or your blood pressure. And after some sessions, you would just understand, for example, your natural number is just 75. So if you are having, or if you are about to have panic attack, the number gonna increase, right? So you can understand like your own natural flow. And after a point, you can just prevent having panic attack based on biofeedback. The story here is they're gonna actually attach a lot of stimulus on your body, or a lot of systems in your body. So this way they can just monitor the actual heart rate, blood pressure, and so on. And if something is just going up or down, they're going to tell you. So you know about the context, and you can just monitor yourself after a time. It's just very good. And Apple Watch actually, the new upgrade, it does that, which is just very interesting. So if you have Apple Watch, you can probably address your own problem at some point and regulate your own system, and use and apply biofeedback method on yourself. Relaxation techniques is just very important. They're going to be definitely a question in your quiz about this. But in general, it's going to be shifting your body into a state of low arousal by relaxing your different parts and just control your breathing. Because like it's just very important to just be relaxed, right? Just learning about this technique is just everything. I'm still in the middle of that, but yeah. It does have a lot of benefits, but the main one is whenever you are doing relaxation techniques, you're gonna release some sort of opioids. That's gonna help you a lot to just enjoy yourself, have like all those good feelings that gonna come from drugs and opioids. So do that, do relaxation more and more. Distraction, just basically distracting yourself from pain by focusing on some sort of irrelevance topic, or some sort of distracting activity at some point. It's just good for low level pain. Like whenever you are just suffering from chronic pain, you cannot distract yourself. I mean, whenever you are having migraines, you cannot just distract yourself and just say that, oh, okay, now I'm having migraines. Let's talk about the show that I was watching yesterday. No, it's not gonna work for migraines, but like some small pain, it might be effective. Coping skills training, there are like so many trainings out there. Most of them, they are like based on cognitive behavioral therapy, and CBT also is just based on the elements that I already mentioned. For example, biofeedback, it can be very effective when it comes to CBT. For example, you're gonna do like 2 sessions of biofeedback. You're gonna know about your heart rate, your blood pressure, all of those automatic processes. Then after that point, you can just monitor yourself. You can know, you can just understand the context that's gonna bring you panic attack or any other problems. And after some point, you can just do CBT on yourself with the help of your therapist, because we said that CBT needs some sort of monitoring, some sort of supervision at some point. So it is very important to have a therapist when it comes to CBT. Having a therapist actually can help you a lot to just prevent relapse if there is any, and have controlled behaviors, especially emotional responses to pain. Pain management program, they are very common, especially at different schools and universities. Different workplaces, actually, they do have pain management programs as well, but they're gonna be different elements for that. For example, there has to be some sort of initial evaluation for doing that. or like you as a patient, you have to collaborate with your therapist, otherwise they cannot help you at all. And based on your participation and the information, and also we talked about interpretation of symptoms, your therapist and your physician, they can work together and give you some sort of individualized treatment. So this way you can just manage your pain. There are going to be several components when it comes to pain management program. Number one going to be patient's education. Involvement of a family is just very important as well, which can actually prevent from relapse. Because like if your family, they're going to collaborate, it can help you a lot to just prevent any sort of relapse and just be on track for doing your program in a good way. So that was all about chapter 10. It's an interesting chapter because like we all have pain in different aspects. I would suggest you to just check the lecture, read the material from the book, and let me know if you have any questions. And I guess that is all. Take care. Bye.